organs or tissues. We said you have to match the blood group and also match MSC class 1 and class 2 loci. That's MSC class 1 A, B, C and MSC class 2 DP, DQ, DR loci. And only transplant, as you see, the closest match possible. But if you know the donor is a living donor, then you can do a mixed lymphocyte reaction, meaning collect blood samples from the donor and the recipient and separate the lymphocytes and then culture them and see whether they are fighting with each other. If they don't do any active proliferation, then you can safely do the transplantation. Any question on that mixed lymphocyte reaction? It can only be done on the living donor, and it takes that much time. You have to culture the lymphocytes for 3 to 4 days to see whether they will react against each other. Okay.
So you transplant into the donor? The lymphocytes into the donor?
No. Collect lymphocytes from both donor and the recipient and put them in a culture.
Okay.
And then observe.
Dr. Reddy,
Yes.
you said if there was no proliferation, then it's okay to do the transplant.
Yes. Yeah. Okay. Bone marrow transplantations are, as you know, are commonly done with a living donor. They always look for a living donor, so the mixed lymphocyte reaction is common in those cases. Okay. And of course, we are talking about all allograft recipients must take some immunosuppression to retain the transplanted organ. They take some drugs for the lifetime. And these could be any of these following things. You can abolish completely especially the T lymphocytes using either monoclonal antibodies or other means. But if you abolish totally all the T lymphocytes, then the patient becomes very immunosuppressive and they may get all kinds of infections. So that's not done these days. But you can use all these drugs. Corticosteroids like prednisone is very commonly used by transplant recipients for the lifetime. And that's why you might see transplant recipients having the adverse side effect of prednisone that we will talk in later classes, the Cushing syndrome and all that. But we said all these other immunosuppressive drugs are commonly used, cyclosporine. And as you know, this transplantation immunology has come up with cyclosporine, but that is being used in some of the hypersensitivities or autoimmune diseases in animals nowadays. We will talk about those later. But cyclosporine, in spite of being a good immunosuppressive agent, has its own side effects. And so they are coming up with new immunosuppressive agents like this Cellcept, mycophenolate mofetil, or rapamycin, or more recently there is the tacrolimus. All are derived from fungal organisms and have those immunosuppressive activities. And the recent ones, like the tacrolimus, also called as Prograf, is used in very small doses and has very less side effects. Any question? And these immunosuppressive drugs mainly inhibit the subsets of T cells that are producing, like, for example, interleukin-2, okay, the cytokine is being inhibited. And so this is kind of selective inhibition or selective immunosuppression, not to cause the recipient to get infections or develop cancers. Too much immunosuppression might lead to development of cancer. Especially it has been observed in people getting skin cancers in transplant recipients. You can also use monoclonal antibodies against very specific subsets of T lymphocytes that are producing these cytokines. If you know a neonate needs, question?
Were they all were they all selective immunosuppressive agents?
Yeah. Selectively immunosuppress, meaning you don't want to immunosuppress on all aspects, antibodies, T cells, cytotoxic cells. We don't want to inhibit macrophages, neutrophils that do phagocytosis, but mainly want to inhibit the T lymphocytes, subset of T helper cells like Th1 cells. Okay. If you know a neonate needs transplantation, and if you know the donor antigens can be injected to make the neonate tolerant for the transplant. Induction of tolerance in neonates is very easy. So you can inject donor antigens into the neonate. Blood transfusions, if you know the living donor, you can do blood transfusions from the donor to the recipient. I was showing this slide. Look at that acutely rejected kidney in a dog, transplanted kidney in a dog. You see a lot of infiltration, and most of these are lymphocytes, mainly cytotoxic T lymphocytes that are mainly causing damage to the endothelial cells lining the blood vessel walls, and that's how they cut out blood supply first to the transplanted kidney. And then later on they might attack other cells of the kidney as well. Okay, that's acutely rejected. Whereas in a chronic rejection, which might take place in years to come, there is still lymphocyte infiltration into the kidney. Okay, those are the main things that I want to talk. Any questions on that transplantation immunology? If not, we will go on to the next lecture. Here is vaccines. We're talking about vaccines production and use. Important because you make a lot of money on vaccines when you go to practice. Vaccines are the most cost-effective method of controlling and preventing many infectious diseases. But nowadays there are also vaccines for cancer, for example. There is a cancer vaccine for melanoma in dogs, for example. So we are talking about not only infectious diseases, but also now we are talking about vaccines against development of cancers. Say, for example, we will also say something about cervical cancer in females caused by what virus? Papilloma virus, and nowadays There is a vaccine against HPV, and is being given to females as well as recommended for males also. So that's again vaccine against the cancer, but it's a vaccine against the papillomavirus. So we'll talk about those. Vaccines have eradicated many diseases like smallpox, of course, like brucellosis, for example, is eradicated in Alabama in all food animals. It might be present still in dogs, but we talked about this, how specific acquired immunity develops. We talked about passive methods and active methods. Passive method is short duration immunity. Active is long duration. We talked about that using passively injecting immunoglobulins. We'll talk about this, but passively injecting immunoglobulins, what are the good examples for that? Anybody?
Horse serum?
For what? You said horse serum against anti-tetanus serum, anti-snake venom. We talked about those. So here actually injecting immunoglobulins from horses, immunized of course, to treat cases of tetanus or snake bite. That's passive method of giving specific acquired immunity. Cholesterol antibodies, we talked about that, failure of passive transfer and all that, but passive method of antibodies from the mother could also be through the placenta, right? At least in primates, and to small extent in dogs and cats, about 5% through the placenta. So that's passive method, but that's short duration. Protect neonate for 2 to 3 months. But it could be also be, prophylactic method by injecting immunoglobulins. Also therapeutic, but also prophylactic. Active acquired immunity, which said by actually injecting artificially the organisms, which we now call as vaccines, or getting a natural infection. For example, a person getting polio is immune for the rest of the life. Okay. So that's natural infection. Use also specific acquired immunity of usually of long duration. And coming back to this artificial immunization or the vaccines now, it could be given as living organisms or used as vaccine candidates, or the organisms can be killed, and that's non-living organisms. Back to this living organisms, as we call them, also modified live organisms sometimes, could be recombinant, meaning genes of interest from the pathogen is inserted into vectors. Vectors that are non-pathogenic, say for example, canary pox virus could be a vector carrying gene of feline leukemia virus, which you will see. Canary pox virus is non-pathogenic to cats, but it will carry the genes of feline leukemia virus and then induces immunity. Bacterial vectors could also be used. Non-pathogenic salmonella or E. coli could be used to carry the genes of pathogen of interest. We will see those. And sometimes for contagious eczema, it's a pox virus. We use still living organisms to immunize. It will cause minor problems, although it's a living organism. Heterologous viruses, like Zenner used cowpox virus to treat for smallpox. Now, measles virus can be used to vaccinate against distemper. Distemper. It's a heterologous method of vaccination. Culture attenuated. You can attenuate the organisms by artificial method of culturing. These example is distemper again. Are genetically attenuated. For example, in case of pseudorabies virus, they have deleted the gene that's required for virulence. Gene of virulence is deleted, so the pseudorabies virus is still living, but it's non-pathogenic because the gene of virulence is deleted from that organism, and now we can use it as a vaccine candidate. Coming to the killed vaccines, we heard the term Bactrians. These are killed bacterial vaccines called Bactrians. You are killing the organisms completely and using them as vaccine candidates. Or from organisms, you can just use the epitopes, for example. You know the term epitope. Epitope is the small portion of a bacteria or viruses that induces immunity. Okay. So if you know that epitope, you can isolate that epitope and use it as a vaccine candidate. Or you can clone them by recombinant methods. You will see that. Or you can just use the toxin for the organism. Again, the tetanus shot is a good example that you all took. It's a toxide. It's the tetanus toxin that has been neutralized, but it's still immunogenic. It will produce antibodies that will act against the toxin. That's toxide. You can extract the DNA from the organisms and use it as a DNA vaccine. A good example is the first DNA vaccine for West Nile virus, for example. Synthetic antigens. Again, if you know the epitope, you can synthesize the amino acids and use it as a synthetic peptide vaccine. It's not the real organism or the whole organism. It's just the epitope, but again, it's not the real epitope from the organism. You are synthesizing the amino acids of that synthetic peptide. So those are synthetic antigens. We'll see again all these.
Could you,
Ideal vaccine, as we say, should be question.
yeah, could you explain horologous and culture attenuated one more time?
Culture attenuated, distemper. You can pass it through tissue cultures. You will see those slides again, but if you passage this virus through tissue cultures 3 or 4 times, they lose their virulence. Okay, you will see that slide again. That's culture attenuated.
And heterologous?
Heterologous. Okay, heterologous. You can use measles virus to vaccinate against distemper, for example. Measles virus causes problems in humans, but not in dogs. You get to use. Same thing, cowpox virus. Okay, doesn't cause problems in humans, so you can use it to vaccinate against smallpox. So that's heterologous. Vaccines should be effective, cheap, but should not cause any adverse side effects. But as you know, there are all kinds of controversies against vaccines. Cheap, especially for poultry or sheep and goats, you cannot spend too much on vaccines. they should be stable, if possible at room temperature, and should be adaptable for mass vaccination. Say, for example, if you can spray a vaccine and immunize a lot of chickens or sheep and goats, that will be very cost effective. It should contain microbe in question, either killed or live, attenuated, or at least portion, like the epitope of the pathogen, or synthesized portion of the epitope. So list of vaccines, toxide, I don't have to say, you all took it again. It's the actual toxin from the Clostridium tetani that has been neutralized to not cause disease anymore, but it's still immunogenic. Anti-serum, again, you immunize horses with, say, for example, rattlesnake venom that has been neutralized. And so when you inject horses 2 or 3 times, they develop a lot of antibodies against the snake venom, and you can use that to treat any rattlesnake bite. Again, that's anti-serum. Could be anti-tetanus serum or anti-snake venom. Again, mostly produced in horses. Kill vaccines are also called inactivated. Organisms are completely killed by some means, either heat or use any other chemicals. Could be safer to use as vaccine candidates. Live attenuated, also known as modified live. This term could also be used, meaning the organisms will still be